Hi, my name is Jamie DiDomenico, and today I will present on the health of Norway compared to the United States. So coverage in Norway is universal and automatic. All legal residents have equal access to health care regardless of their age, gender, race, country of origin, area of residency, or their socioeconomic status. Undocumented immigrants also have access, but it is limited to acute emergency care only. Furthermore, undocumented children receive the same care as regular citizens. The universal coverage is financed through national and municipal taxes, and Social Security also contributes to public retirement funds, sick leave pay, and the reimbursement of extra health care. Although private health insurance is growing in Norway, it covers only 5% of all healthcare services, and it primarily covers elective services. On the other hand, as we are well aware from our course, the United States does not have a uniform healthcare system or universal healthcare coverage. As compared to Norway, the U.S. healthcare system can be described as a hybrid system. The United States pays for healthcare through a mixture of out-of-pocket payments, private insurance, employment-based insurance, and government insurance. So, infant mortality rate is an important indicator of the overall health of a population. According to the Central Intelligence Agency, Norway ranks number 221 for the world's infant mortality rate, while the United States ranks at 170. The total per 100,000 of Norway is 250, while the United States is 580 per 100,000. Norway has nearly the lowest infant mortality rate, with just 4 countries ranking below it. The U.S. has a significantly higher infant mortality rate than Norway, indicating that the level of health in the United States is lower than that of Norway. And when we're looking at this chart, so this is infant mortality per 1,000 live births in 2014, and this is for comparable countries based on wealth. So the United States is at the very top at 5.8 per 1,000, and although Norway is not on there, we would be right in between Austria and Sweden at 2.8 per 1,000. For total healthcare spending per capita, according to the Health System Tracker, Norway spent $6,347 in healthcare spending per capita in 2016, while the United States spent $10,348 that same year. The average spending of other comparably wealthy countries is approximately $4,908. Although Norway is above average on healthcare spending, it is still about $4,000 less than the United States. The U.S. spends the most on healthcare per person in the world, spending 31% more than the second highest, which is Switzerland if you look at this graph. Norway ranks number 4 on this list, making this country one of the top spenders on healthcare among the wealthy countries, but it is still significantly lower than the United States. For prenatal care in the first trimester, all pregnant women in Norway are entitled to maternity care from either a midwife or from their general practitioner, and the consultations are free of charge, and they are recommended as soon as a pregnancy is confirmed. In Norway, folic acid supplements are recommended in the first trimester, along with a balanced diet, a healthy weight, and cessation of risky behaviors. The first regular appointment is recommended to occur during weeks 8 to 12 of the first trimester, in which the midwife or doctor would discuss specific topics such as the plans for future prenatal care and a measure of height and weight to make sure the mother is healthy. 80% of mothers in Norway start prenatal care in their first trimester, while in the United States, prenatal care in the first trimester differs based on the payer source. So 89% of privately insured mothers in the United States receive care in the first trimester, compared to 66% of mothers on Medicaid and 57% of uninsured women. So for children who received all recommended vaccines, in Norway, all children are offered vaccines through the Children's Vaccination Program. In 2016, Norway hit a record high for the amount of 2-year-olds that were vaccinated for all the recommended vaccines. In Norway, the measles vaccination, the diphtheria vaccination are the 2 recommended vaccines, and it was 96% for both in 2016. In the United States in 2016, the percent of children aged 19 to 35 months that received all 7 of these required vaccines was 70.7%. Although the United States percentage was way lower than Norway, as you can see on the slide, Norway only has 2 recommended vaccines for that age group, while the United States has 7. So that's definitely a factor to take into consideration. So for safe drinking water, it was pretty similar between Norway and the United States. According to Norway's specified criteria, more than 92% of the population has a good water supply, and about 90% of the population receive water from waterworks that must be approved and regulated by the Waterworks Registry at the Norwegian Institute of Public Health. And similarly, in the United States, over 90% of the nation's water systems meets the standards of the Environmental Protection Agency. The Safe Drinking Water Act was significant in reaching this goal. This act was established to protect the quality of drinking water supplies in the United States through meeting the standards of the EPA. There's about 90 standards for the EPA, and this act was enacted in 1974. And according to this world map, you could just see that the United States and Norway both have safe to drink tap water compared to the rest of the world. So for uninsured adults ages 18 to 64, obviously since Norway has universal coverage, we have total coverage of their citizens, so there are no adults uninsured. But when comparing to the United States, as of 2016, there was 12.4% of adults uninsured, and this has decreased from 2014 and 2015. This was most likely due to the Affordable Care Act, but with Trump's new presidency, as we've learned in class, there are revisions and repeal of this act going on, so we're most likely to see changes in the future. The unemployment rates of Norway and the United States was very similar. As of January of 2018, Norway's unemployment rate was 4%, while the United States was 4.1%. In conclusion, the main difference between the health in the United States and Norway is that Norway has universal coverage while the United States does not. The infant mortality rate of Norway is significantly lower than the United States, and this is a big indicator of the nation's health. Norway's healthcare spending is above average, but is still significantly lower than the U.S. Prenatal care in the first trimester was not very different when comparing Norway to privately insured Americans, but this gap increased when compared to the Medicaid women and the uninsured women of the United States. More children have received the recommended vaccines in Norway compared to the United States, but the amount of recommended vaccines differed, and we need to take that into consideration when comparing the countries. Overall, Norway's statistics displayed a better healthcare system and a healthier country than that of the United States. Thank you.